Hello, welcome everyone to the information session for the Health Information Management Program, C139. My name is Kimberly Durafel. I am the program coordinator and professor in the HIM program. For today, I will be discussing the basic information about the Health Information Management Program, how to be successful within the HIM program, as well as the courses that are covered over the 4 semesters, and I'll go into some detail in regards to the career opportunities that are available after graduation. A little bit about the Health Information Management Professional. This is a career opportunity for those who are interested in working in a hospital setting, but not working with the patients directly. So we focus more so on telling the patient story digitally. Today's society is full of electronic information, and we are making that transition currently as we are part of the electronic age. Health Information Management Departments, otherwise known as Health Records Department, are going through a major transition from the paper records, as you see here, more so to the electronic health records. So not all the hospitals as of yet are completely transitioned to the electronic health record, but they're in transit. And so many of the hospitals are requiring skills and technology and how to interpret electronic data. So that's where the HIM specialists are very important in interpreting, collecting, and analyzing the data. Please note that we are not file clerks. We deal mostly with the data from the patient's record, and I'll go into a little bit more detail in regards to some of the job functions that we currently do and how the HIM program prepares you for an industry in the health information management professional. So an overview of the program is, again, like I had mentioned, we design the program with the interest for those who are interested in working with health data. The HIM program teaches you how to effectively and accurately interpret the patient's data, also how to collect this data, how to then, of course, analyze the data once it has been collected, and then how to present this health information on such things as Excel spreadsheets, on charts, on pie graphs, and so on. We also teach you how to protect and the legislation on how to keep the health data confidential in a variety of different healthcare facilities. The HIM program prepares you for the importance of data quality and the standards that are required for collecting the data, such as in the classification systems, the different legislation that is required to know on how to keep the data confidential, safe, and secure, as well as the documentation standards that are required for collecting the data. The courses are taught by a number of different faculty, both part-time as well as full-time, and majority of our faculty have either been working in healthcare for a number of years or are still currently working in the health information management industry. We use a variety of different teaching techniques and methods, such as lectures, discussions. We have a lot of group work so that we get the ideas from the students, as well as, of course, teaching you the fundamentals. We have a number of different software that we use within the program because, again, we're preparing our students for these different softwares that are used in the industry, such software as the ICD-10 and CCI, which is the classification systems known as the International Classification of Diseases, as well as the Canadian Classification in Interventions. We use Tableau. We also use Med 2020 and WinRex for the abstracting system, and Excel as well as Word. Upon graduation, after completing the 4 semesters, you will be prepared to work in the 4 domains of practice for an HIM professional, and these include data quality, privacy, classification systems, data analysis, again, all done within different healthcare facilities. Upon graduation, you will receive a college diploma. You will also be delivered, the program is delivered full-time. It is a 2-year program with 4 semesters. We only take intakes in the fall semester, and it runs from September to April with the summers off, and then the 3rd semester will start again the following September. The program intake is for both domestic as well as international students. The admission requirements are to have a Ontario Secondary School Diploma and or equivalent. We also require grade 12 English, grade 11 or 12 math, grade 11 or 12 biology, with a minimum grade of 70% in all required courses, such as English, math, and we prefer biology. It is very highly recommended that you have previously worked with Microsoft applications such as Word and Excel. But again, we do have 2 courses in Excel, so not too much. Don't worry too much about the Excel course. We do teach you that here, but please have working knowledge within the Microsoft applications such as Word. To be successful in the program, you have to be comfortable with technology. You also have to have an enthusiasm to learn a variety of different softwares. As I had mentioned before, we're working with Tableau, Med 2020, the different classification systems such as ICD-10 and CCI. So we do we teach this in quite a demand as it is in the industry. You have to also have good time management skills and study skills to help you succeed, so to be organized so that you get all of your work done. To be successful in the program, the first-year students are designed to increase their success, and we do offer a student success program to help you out with this, and we have a mentor or a couple of mentors that work alongside the first-year students to increase their success. We also have an open door policy with the faculty. So if you do have a question, you can call us or email us, rather, now that we're online, and we can set up a meeting with you so that we can answer the questions as they need to be answered. So feel free to reach out to ask the questions to the faculty specific, and of course I'm always there to answer any questions that the students may have. There are also a number of student resources here at George Brown that the students can take advantage of, such as our hub on Blackboard. Like I had mentioned, we have a student success program. We also have one-to-one consultations between the faculty and the students. If you need to speak to a faculty, just again set up these one-to-one consultations. We also have a learning and time management tools. We have many tips for success on specific sheets or workshops in regards to being successful. There's also a self-referral form and early alert. So as a coordinator, I keep in touch with the faculty to make sure if there are any students that are struggling. And what I do is I try to email the students on their success, and or if they are having difficulties, as an early alert, and to try to see what's happening with the students. So again, just to follow up with the students on any kind of difficulties they may be having. There's also a guide to professional success within the student success program. Okay, so now we'll get into a little bit more about the coursework in the different courses throughout the program. So again, because of the pandemic, we are currently teaching online for the fall of September 2021. We will be teaching online. Classes may begin as early as 8 o'clock and finish possibly as late as 6 o'clock. So that doesn't mean you go straight from 8 a.m. to 6 p.m. It's more that you may have one class from 8 to 11 and then have the rest of the day free. Or perhaps you may have a class at, say, 10 o'clock to 12 o'clock, and then possibly another class from 4 o'clock to 6 o'clock. It really depends on the faculty schedule, as well as the time availability for, if we have to, work out any details with regards to the part-time faculty. So again, just to note that we do have classes that may start first thing in the morning, and again, we may have a class that may end at 6 o'clock. So just try to time yourself or to prepare your schedule in case there is an 8 o'clock class. This semester, we have 2 classes that are at 8 o'clock, and then we have 3 classes that go all the way to 6 o'clock. So again, it does depend on the faculty schedule. There is approximately 23 hours of class time per week, and again, there are in the first semester 7 courses. So again, it is a full load. So that's why we had stated that it is a full-time program. Most of the classes or courses are 3 hours. There are a couple 4-hour class time, but again, what we do is we divide that into a 2-hour break. So there will be 2 hours and then a break and then another 2 hours, and or you may have the other 2 hours taught 2 hours on Tuesday and the other class maybe 2 hours on Thursday. There is also approximately the equal time of reading the chapters in the textbooks as well as completing the assignments. So it is a full-time program. So again, it's almost like a full-time job. So 23 hours of class time, again, that's online, as well as you can probably guarantee at least another 20 hours of reading and completing exercises and homework assignments. The coursework will include individual assignments, as well as some courses will have group work, some will have presentations, so you'll be presenting either online or when we go back to the classroom, you'll be presenting in front of the class. There are tests in every course, as well as possibly midterm and or final exams in the courses. For the first year, we have the foundation courses. So we have the biomedical courses. So you'll have semester 1 and 2. So you'll have anatomy 1, and then in semester 2, you'll have anatomy 2. That is the same for pathology as well as medical terminology. So those courses, there'll be 6 of them. So 2 anatomy, 2 path, and 2 terminology, which is critical in learning how to interpret the medical documentation. There's also a healthcare law course. We have the Intro to Health Information Management. So again, knowing more about the profession, knowing more about the healthcare system and how HIM fits into the role of healthcare system. We have the Intro to Excel. We have an English course, we have a math course, we also have Introductory to Statistics in second semester, and in second semester we also have a Transition to Workplace course, which is more of a business communication, so preparing the students for placement as well as learning business communication, so such things as how to conduct yourself professionally, as well as how to write a professional email. And then at the end of the second semester, we have 1 week of placement, which would be more of monitoring the what goes on in the Health Information Management Department. In the second year, these are more complementary courses. So everything learned in the first year are beneficial to the second year courses because again, you do need to know about the body parts and body terminology or medical terminology for the different courses that you'll be having in second year. So we have the epidemiology and research methodology, which again is the reason why you have math course in first semester, intro to statistics in second semester, so that you can understand what needs to be collected in a research methodology course as well as biostatistics. We have an advanced Excel course in semester 3 that teaches you how to navigate more formulas and to develop different graphs and presentations of data in the Excel. We have health information systems, so teaching you more about the electronic health record as well as health informatics. We have a second law course, which is the privacy and release of information course that teaches you more about the legislation and requirements for confidentiality and securing health data. We have the coding classification system that teaches you how to code and abstract health information into the different databases. We have a course in data analysis to help you decide on what should be analyzed, how to analyze data, and then how to present the data once you have analyzed it. And then we also have clinical placements that are offered 1 day a week during both the third semester as well as the fourth semester. At the end of the fourth semester, there's a 3-week block period where the students go out to a placement site, again, pending what goes on in the pandemic. So the placement experience, like I had mentioned, is both in the second semester, the last week of the semester, as well as in the third and fourth semesters. So the purpose of the placement is to expand on what was learned in the classroom, as well as to gain professional as well as interprofessional skills within the industry. But again, just to note, due to the pandemic, currently the placement sites are temporarily on hold, although the students have completed specific projects that would have been given out in a placement setting. They are doing the coursework more independently and presenting those projects to their classmates, again, using the technology such as Microsoft Teams. You are required, if we do go back to the placement sites, you are required to have pyramid requirements such as your immunizations up to date, as well as a cleared police check in vulnerable sector. So again, like I had mentioned, the first placement would be at the end of the second semester in week 15. It's for 1 week full time. And the second year placement is during third and fourth semester, 1 day a week on Fridays, together with a 3-week block period at the end of week 15 in semester 4. So these would be, the students would be completing related HIM activities such as administrative tasks and technical skills. We also require you to do such projects that require hard skills, so learning the software, performing Excel spreadsheets, coding a number of different charts, helping the placement sites out with auditing of the data. You have to, again, practice with your communication, professional communication skills and interactions with the HIM team, otherwise known as soft skills. So we at George Brown, for the HIM program, find the placement sites for our students. This could, the placement sites include in hospital settings. We also have a variety of other healthcare facilities that the students may be attending as their placement site, such as the WSIB or High Rock, which is the Health Insurance Reciprocal of Canada. We have many placement sites within the Greater Toronto Area as well as outside of the Toronto area, again, if the placement sites are on site. Some of the sites that the placements, the students go for two placements is at St. Mike's, Mount Sinai, UHN, Mackenzie Health, Holland Bloorview, which is a rehabilitation hospital for kids, North York General, and like I mentioned, WSIB, as well as High Rock Health Insurance Reciprocal of Canada. So these are our placement partners who welcome the students for placement. There are also many others, but these are just some that I wanted to mention. Now a little bit about the health information management industry. Some of the job titles that the students are hired as. Again, you will find some positions identified as a health information management professional and or health information management specialist. There may also be some job titles called health information technologist or technician. But again, most often the HIMs find career opportunities in specific type of roles, such as a coding specialist and or the privacy officer and or the health data analyst and or a release of information specialist. So I would like you to look for, on Google to help you understand a little bit more about the health information management professional by doing a Google search on health information management jobs available. And again, you'll see a number of them listed on the Google website and or Indeed website. So again, that's just something that if you wanted to do as a homework assignment to look to see what is available before either accepting and or applying to the HIM program. But again, these are usually the job titles that are given to many of the different areas for our graduates of the HIM program. So again, most often the graduates are generally perceived by our placement partners. So again, going back to the other slide, if you look to see on those specific hospital settings or websites, you will see some of the other job functions as well as the job positions that are identified that again, HIM professionals can apply for. So that concludes our presentation on the information session for health information management profession. I hope that you are able to take away something. And again, looking forward to your questions. Here's my email. If you wanted to email me on specific questions, I can again answer them for you. So again, thank you for listening to the information session. I hope you have a wonderful day.